a case that maybe had a memorable transformation?
Actually, every month we can write a book. Okay, that much memorable patients we used to get.
So maybe this is an idea for what made you specialize in this particular field?
Actually, when you take a plastic surgery, it's a very broad specialty. Even hand surgery. We are posted in cosmetic surgery every year 1 month. During that time,
bit about what makes it stand out and what are those key factors?
All over the world, Chennai doctors are well respected. If you go and say, I am from Chennai, all the post surgery, they have not maintained the weight, they gain abnormal weight gain, then they blame the doctor that it's not work. So maintaining the good.
Listed on 3 best rated and to be called one of the best in the business.
This is the 7th consecutive years we are listed in ThreeBestRated.com.
Congratulations.
Thank you. Actually, it makes me very proud and happy. Same time.
I'm here with Dr. Karthik Ram, one of Chennai's leading cosmetic surgeons, and we're here to find out more about his journey and ask him a few very, very important questions. Hi, doctor. How's it going?
Hi, Paloma. Everything is good. How are you?
I'm doing well. So I'm really excited to find out more about your journey in this field, starting off with the all-important question that I think everybody asks any doctor, which is, what made you specialize in this particular field?
Actually, when you take a plastic surgery, it's a very broad specialty. Even hand surgery, even the reconstructive plastic surgery after the cancer resection, a lot of trauma-related work. This is the major core of plastic surgery practice in India. When I was in training, I realized that most of the time, patient doesn't know who the surgeon is because it was admitted under orthopedician or other cancer surgeon, and we go like a ghost and do the surgery and come back. So we really don't have our own patients. That made me feel upset. So one specialty, subspecialty where the patient is ours is the aesthetic plastic surgery or cosmetic surgery. That's the reason I took cosmetic surgery as a specialty. One other major reason is when I was a teenager, I suffered from the male breast issue. Basically, now it's very common problem among the teenagers. That time, way back in 90s, we don't know whom to go and tell and how to inform to my parents. And this time, that the bullying will be too much in the school time, and you can't go to the common dress changing room. So this amount of psychological impact what a person goes through because of the cosmetic issue, I was exposed to the teenage time itself. So that's also one other reason. I understand how patient feels when the people feels when they have a problem because of the cosmetic issue. That's the other reason I thought I'll take the cosmetic surgery as a specialty.
Right. So I'm very curious to know, on your journey, was there sort of a particular moment where you thought that, okay, plastics or cosmetic surgery is for me?
When I was in training, we are posted in cosmetic surgery every year 1 month. During that time, my senior consultant used to tell us how difficult the cosmetic surgery is, and each and everything is having a lot of big impact for the patient's recovery. And all those things made me realize, why shouldn't I take this difficult field and make an excel in it? Because the curiosity, what is in it kind of, that makes me take the cosmetic surgery as my specialty.
Okay, so we know where the story began. So tell us a little bit about how you got from there to here, where you are now.
During my training, I was sent to Chelmsford in UK for a small observership program during that time. So that time I realized all the specialty cases, say example burns or a hand surgery, everything come to that particular unit alone. Not like Chennai where every hospital has a doctor, everywhere patients can go. There is no particular number of cases going to the particular place. Then I realized when I started my practice, I thought when I start doing particular cases in a large volume, I become a master in it. For that, I need the volume. How to build the volume? That's always really get confused how to get the volume. That time I attended a conference in Las Vegas. In the conference, there is a separate session for the marketing. That really attracted me. That helped me to bring the particular kind of patients to me. So once I started the practice, I started the website, and from the website we used to get leads. And earlier days, every week we get only 1 or 2 leads. Now we get at least 15 to 20 leads per day. So from that to this, not happen in a single day. It took 15, 16 years to reach here. So From a young, passionate plastic surgeon, very much interested in cosmetic surgery, to now we reached a level where we are becoming an expert and we train a lot of young plastic surgeons in the particular specialty all over the India as well as from the other countries.
So Chennai has become a sort of, hub for plastic surgery. Maybe you could tell us a little bit about, what makes it stand out and what are those key factors?
All over the world, Chennai doctors are well respected. If you go and say, I am from Chennai, all the doctor community will respect you because that's what our seniors set the example, set the trend. So, earlier days, we used to get clients across the globe from Africa, New Zealand, Australia, US, any countries, people come to us. The reason for the any medical tourism is only two. One, the facility and the infrastructure and the expertise are not available in the particular country. Say example, Africa might not have the cosmetic surgeon, so they're coming all the way to India. And other thing is it's cheaper in India than other countries. Say example, if you do a cosmetic surgery in Australia, it costs 8 times more than the Indian cost. So that's the reason they used to travel across the globe. Now the trend is slowly changing because the expertise is available across the globe. People prefer their country than coming to other country. But still, India is much cheaper than the other countries. When they select the India, then select the doctors. In among the India, who is best and whose quality is good, that's how they reach Chennai and they reach Chennai doctors. Furthermore, if you see, we are specialized in few procedures, like example, multiple lipoma, male breast correction, rhinoplasty, breast reduction, large volume fat transfers. These are all the things we published a lot of articles related to this in our new technique. So those techniques, when they don't do in their country, they are reaching us for their particular surgery. That's the other reason people are coming nowadays. So the cost factors and it's not available in their country and the few innovative procedures bring the patients to our country and to us.
So, what are the biggest misconceptions people have about plastic surgery and how do you address them?
So the biggest misconceptions, what usually if you ask anybody, they say that the plastic surgeries, that especially the cosmetic surgeries, are luxury surgery. But it's directly opposite. You think that a middle-aged woman with a heavy breast getting the back pain and neck pain coming for the breast reduction, do you think it's a cosmetic surgery or a luxury surgery? Obviously not. A young boy trying to attempt suicide because of the male breast issue, then parents found out and bring him for the surgery. Is it a cosmetic surgery? Definitely not. One IT professional having a completely deviated nose and he never poses any photograph, always stand in the back of everybody to hide the nose in the photographs and having a breathing difficulty, doing a rhinoplasty, is it cosmetic surgery? Definitely not. People always think that this is a luxury surgery, this is people only, the film industry people do it. Yes, they do it. That's hardly 0.05% of the whole surgery what we do. So the people every day suffer from cosmetic issues. They are the people come in auto or a train or a bus. You can't see a Audi or a Benz every day in our center. Every population can afford it. Everybody, when they have a problem, they approach us.
So, can you highlight some of the latest advancements or technology in plastic surgery that you think people should know about?
See, whenever a patient comes to us for the consultation, usually they fear about few things. The main thing is the recovery process, how is the pain, and how soon I can go back to the work. So earlier days, if you remember, our dad and mom went in for a surgery, they always sleep the whole day and next day always they're drowsy. All those things are not a scenario nowadays because a lot of latest advances in anesthesia gives a short acting anesthesia medicine. Operation theatre table itself, you wake up and say hi to us, then only you leave the room. That faster recovery your anesthesia is. Same way earlier days, we used to keep a drain tube. You have to carry the, especially example, tummy tuck. If I do a tummy tuck, you have to carry a drain tube. We have to walk with the drain tube. More than the surgery, every time when the drain tube moves, it hurts. Like these kind of discomforts are slowly, erased by not keeping a drain tube. The immediate discharge, say example, tummy tuck, they'll keep it for a week. Earlier days, till the suture removal in the hospital. Now they discharge in the next day evening and go back to the house in their own environment. So that faster we are kind of reducing the hospital stay, number of hospital stays. So the infection rates are very less when you are discharged faster. We have a lot of pain medications, lot of we understand about the Indian skin a lot nowadays, so that we can make them recover faster than earlier. So they go back to the work early. This is, I think, that a lot of recent the machineries also makes it more, the damage is less. The damage created by surgery is very less because the latest instrument what you use. All those things make the recovery more faster. So one other thing, earlier days, the plastic surgeons are not trained in cosmetic surgery. So we go across the globe to learn the cosmetic surgery and come to India. But thanks to Indian Association of Aesthetic Plastic Surgeons, where they found 16 centers in India to train the young plastic surgeons. Our Chennai Plastic Surgery also one of the centers who train plastic surgeons across India as well as other countries. And we train almost 25 plastic surgeons till now, so that the patients will be addressed in their own location.
Of course, another factor that most people are concerned about is how safe is it. So in your practice, how do you ensure that complete safety is in place?
In aesthetic surgery, always the safety is very important. Because not like you're going for a appendicitis pain, doing appendectomy surgery, that is a different. Here you're a normal person without any problem, only the cosmetic issue. We'll be taking extreme care to keep the surgery very safe. So if you have a lot of, say example, your blood values are abnormal, we don't operate on you. Till we make your blood sugar level goes down or your thyroid levels become normal, we don't even touch you for surgery. This is not an emergency surgery. And second thing, by visiting multiple centers across the globe, what I realized is reducing the mistake only happened by having a checklist. So we have a preoperative checklist. We send few videos a week prior to the surgery so that they follow all the preoperative instructions like stop smoking and stop alcohol and stopping few medication before surgery. All those videos will be sent a week prior. And preoperatively, we have a checklist. Intraoperatively, we have a checklist. Postoperatively, before discharge, the sisters have to finish the checklist before sending them and follow protocols also very strictly followed. These things will avoid the mistakes so that every patient will have a very safe surgery without any complications.
So could you maybe recollect and share, a story with us about a case that maybe had a memorable transformation?
Actually, every month we can write a book. Okay, that much memorable patients we used to get.
So maybe this is an idea for the future.
I know. So one of the patients I remember, she's a mother of 2-year-old kid, and she was operated 3 times earlier by my own teachers. So she came to me and asked for a corrective rhinoplasty because she's not happy about the nose. I was a little tensed. How I'm going to address this because my teachers operated on her, and how I'm going to correct it? Am I taking a correct patient for the surgery? Am I skilled enough to do this? I saw her nose. I asked myself, if this nose is in me, will I do the surgery or I don't do the surgery? Then I realized definitely I don't accept that nose. That means I need to correct it. So always I tell my juniors also, if your intentions are good, automatically surgery happens and actually happened. So we removed all the cartilage graft what we kept inside and kept an implant, and we corrected the whole problem. And she was happy after the surgery, and she came after 6 months and showed a photograph. That photograph, she took it with her daughter to the 2.5 years now, that time. So she said that 2 years, she never took a single photograph with the kid.
Wow.
Okay, she said that you don't know what you did to me. This is a major thing what I can achieve by taking a photograph with my kid and make that is a very emotional thing for me. There were a lot of emotional stories we used to hear from the patient. One more patient I remember, the patient maybe around 35-40-year guy came running to me asking for a male breast corrective surgery. I was wondering, see, usually people go before the marriage or that is a common time usually patients come for a surgery. I was wondering why you came so rushing to me for a surgery. Then he said that my father is not well. He's admitted in the ICU. The doctor said anytime he might die because of the cancer what he had. So during the cremation, I need to remove the shirt in front of everybody and do the final ritual. I'm not happy to remove the shirt in front of the crowd. So I came for the surgery. These are people think that the cosmetic surgeries are really a luxury surgery as we already think, but it's not. More than anything, I feel that even if people with disease, they know, okay, this disease is there, but this is not a disease. They don't know where to go and approach. And it's really a life-changing moment for everybody going under knife for cosmetic surgery.
So, doctor, do you have any advice for people hesitant to undergo plastic surgery because of social stigma?
See, the most of the time, the people why they don't go for the plastic surgery is not because they don't want to. Because what other people talk about the cosmetic surgery if they come to know about it. Because the person is not worried about what they want. They're worried about the society as a whole. So in that case, even the parent bringing the kid and the kid has a huge breast and she has a neck pain and a lot of skin issues because of the huge breast, parents don't support the kid's surgical process because they say that getting married, what will I tell the husband? So they're not worried about the own kid who is suffering than thinking about the other person who is going to come in the future. Like it's a really annoying thing.
I think it's a little bit sort of ingrained in our culture as well, right? Like, what will people think is such a part of Indian society?
I don't blame the society because they really care for the person, but the same thing, the care doesn't help them to get rid of the problem. So you have to do a good research, find a good doctor, and get it corrected. Then, doing a research for few years together without coming to a conclusion. My strong advice for the people wanting to go for cosmetic surgery, ask yourself, will I be able to live my whole life with a cosmetic problem? If not, don't think about others. Meet a good doctor, get it done.
So, are there any like lifestyle changes or habits that can, enhance or prolong the results of cosmetic procedures?
Even prior to the surgery, they have few restrictions, especially the smoking and alcohol has to be stopped at least 3 weeks prior to the surgery. So, smoking affects each and everything in our cosmetic surgical procedure. After surgery, if you take the body contouring surgery, say example, I did a liposuction for a patient who has a abnormal fat deposition in few areas. So after the surgery, they think that, okay, anyway, I've done a liposuction. What is the point in dieting and exercising? He leave everything or she leaves everything. What happens? They'll bulge in areas earlier it was normal. Okay. So the international clients, when they're coming to us for the liposuction, if I call them after 5 years also, they'll be happy with the result because they maintain their weight and do the regular physical activity. But Indian subcontinent, liposuction, the long-term results of the liposuction might not be, it might not be happy about it because not because the surgeon has not done the surgery well, because post-surgery they have not maintained the weight, they gain abnormal weight gain, then they blame the doctor that it's not work. So maintaining the good lifestyle and doing regular exercise, like any other doctor says, I also say the same, it has to be done. Same way, any surgeries, wound healing takes minimum 6 months. Okay, so you recover fast, we go back to the work fast, but minimum things what we require for them, especially facial cosmetic surgeries, avoiding the sun exposure because the scar becomes worse if you expose to the sun, or using the sunscreen regular basis, using some scar management advices what we give, that has to be followed in a regular basis to get a good results. People think that surgery is everything. Surgery is almost 60% of everything, but remaining 40%, what is the advice we give that has to be followed properly than just blaming the doctor after the surgery saying that scar is not good scar, you're not done well, kind of, So everything matters. So following the post-operative advices is extremely important in getting a good results.
So how does it feel to be listed on 3 Best Rated and to be called, one of the best in the business?
This is the 7th consecutive years we are listed in ThreeBestRated.com.
Congratulations.
Thank you. Actually, it makes me very proud and happy. Same time, I'm a little worried because I need to sustain this position for the country in upcoming years.
Yeah.
So I'll do my best and do my best work to keep this position and make a lot of people happy.
Super.
Thank you.